She had so many different areas of the brain injured,
Right.
and the recovery of that was fair since she was so small when she was injured, but you know, you were just dealing with a lot of different movement disorders, a lot of vectors. It wasn't a pure movement disorder. So that's why I sent her to you too, because she couldn't eat, and so I would have loved to have developed something.
We worked on a lot of stuff like that too.
I know you
That's
did.
a hard one to.
Well, so it's interesting to know that, because you know, you think, oh, they should be able to develop something that straps onto somebody's arm that's a friction, you know, device. Again, kind of along those lines, where the harder they move against it, the more it opposes them. Because I think that's a.
Yeah. And we had a few things like that, but that didn't get accepted into the. So we had
really?
We had to move on from there for the competition last year.
Because typically the strength of these people is pretty good, so it's not that they can't overcome, you know, these things. So it's not a weakness issue as much as it's an inability to control that tremor. And as y'all notice, there are people that have pronation and supination tremors. There are people that have flexion, extension tremors, combinations of both. And we've been really poor at trying to give them medications to suppress the tremor. Because what happens is you suppress them. And so you get this person that only has difficulty handwriting, and then they're kind of just grogged out on Valium and baclofen and all these other drugs that make them a little bit, you know, sleepy. So they don't really like that too much. So the first tremor patient that y'all had was an essential tremor patient. And essential tremor is a familial tremor. And it typically comes on in older age, although some people notice it first in high school. So they're trying to draw fine lines and they notice they're a little bit shaky. So it's not too bad. And then they start getting in their 50s, 60s, 70s, and then they develop a bigger tremor type. They can have tremor of their head and neck, and tremor of their voice. It's kind of a real quaky voice too. But typically it's the tremor of their, although that's embarrassing, it's the tremor of their hands that really bug them. I mean, I had a guy who was so bad he couldn't feed his ATM card in and punch the buttons. I mean, so you can just imagine in day-to-day living trying to button and zip and put your earrings in or put on your makeup or whatever. It's really hard. So essential tremor, again, is a familial type of tremor, and it comes from a dysregulation. And somebody did a nice summary on it, I think, but a dysregulation of pass through the cerebellum and the brainstem. So it's almost though, normally the waves in our brain kind of are out of sync. It's almost as though you've got a syncing of all those waves and you've got a tsunami that comes through.
Constructive interference more.
Yeah. So, you know, interestingly, we're using these medications to act in their central nervous system, but we also do use weights. I mean, we've used those circular weights to just try and dampen tremor. We try heavier tools, and sometimes those things are effective. We lip their plate so that they don't just go skating across the plate. But now we have brain surgery for those patients, and what we do is we put a really thin, it's way smaller than that even, it's a really thin wire, and we insert that deep into the brain on both sides, into a nucleus called the thalamus. And we don't really know how DBS, deep brain stimulation, works, but it overdrives somehow the system, and it shuts off the tremor. And I can show you all a video of that too, because it's pretty cool. But you know, it travels underneath the skin, and then it connects on top of their clavicle to a basically a pacemaker. Same thing you would use for your heart. Only yeah, so it's just. And we actually do, I'm able to program that in the office, so I can change the pulse width and the frequency and the voltage, and it's pretty amazing. It really is. And it can completely dampen the tremor all the way out. Now, Bill and this lady, they have dystonia. And dystonia is a different type of problem. So again, this one's less likely familial, more likely to just come out of the blue. And what happens, for reasons we don't understand, is certain parts of the brain go into overdrive, and so there's too much overexcitation of the brain cells. So instead of just telling your finger to flex and move, it tells your whole hand to move. So you might get some torsion of the limb. And she writes kind of like almost like this. So you can see it's this whole effort, and she's just got this just horrible tremor. And in fact, I think even a Parkinson's patient for you who would have a very good response, I think, from this tool.
Yeah, because one of the things we were thing about there's this assisted living place over here. Once we get this all assembled again, we wanted to sit over there and have a bunch of different people try it. But if you have some specific people that would work with more often, that'd be awesome.
Right.
When you say familial, does that mean inherited?
Inherited. So those folks, like your nurse that you did the vial drawing apparatus, she had essential tremor. And in fact, she ended up having to stop nursing because it just was too difficult for her to work because of her hand tremors. And she doesn't want brain surgery. And that's a personal choice. I mean, it's like probably $60,000, $70,000 to have that surgery, which most of the insurance companies carry, but still, it's a big deal. But the dystonia patients, I think, are really interesting because I think they're harder to treat, and Bill was one of those. Again, if you just look at their brain scan on just a regular old MRI, their brains look normal. And we used to chop up their brains, and their brains look normal. But if you actually look at PET imaging, where you look at function of the brain is not normal. So the brain is hyperexcitable, and again, there's this massive overflow message to the limb that's involved, and it just gives it a bad message. So they're activating the agonist muscles and the antagonist muscles and everything at the same time. Instead of taking turns, they're all just kind of...
Him. He was just...
Yeah, they would co-activate. So that's the lady I was thinking about for you. And she is more than willing to.
Yeah, we get that contact information. That'd be awesome because say about January we should be ready to start testing some interface hand things, basically.
So did you cut these ones off of that?
No, we ordered like that.
Oh, can you? Is that a stupid question? Can you cut these things?
If you have the right tools, you can, but yeah, we're not equipped with that here, so that's why we're trying to figure out which ones to get, because we'll order a bigger sheet so we can have a surface writing. That one was a lot larger.
I love that it tilts.
Yeah, they found that was better for it. So
yeah, it's just great.
See, we can always add the iron underneath if you need to dampen vertical tremors too, to predict their hammer. You don't always have to have the iron. It depends on whether it's this kind or this kind, or both. So the iron is a secondary thing.
So explain that to me. How does? So I did feel that, but what about the other tremor?
So what happened with Amory is her tremors are they're not just horizontal. She pulls it up too. So we had to find a way to keep it down against the table. And so all we did was we took a piece of steel. And so the steel, unlike the copper, is magnetic, so the magnets are attracted to the steel. So by having that steel underneath, it pulls it down.
So it pulled her hand down to it. So weighting, y'all didn't want to weight her?
Well, she said she tried a lot of that kind of stuff when we first went through and different braces and stuff, you know. So this was kind of a follow-on from what we did with Bill. We had the idea of the Bill's thing, and then working with her, they were on all kinds of things last year. Remember the XY plotter?
Wait, what was that?
Crane. Shock therapy.
What was that experiment?
Like an XY thing, you know, trying to, she can hold it, and then it would kind of keep her from shaking, you know, because it would only go kind of smooth.
Oh, yeah.
Imagine, you know, like you'd move around like this only.
Yeah.
But mechanically, we were not.
Essential tremor, dystonia, I mean, it really could be any of those.
What they're thinking, hoping so.
You know, the only tremors we've actually observed, at least I have, is typical Parkinson's. This is a lot like this.
Right.
So we were doing some experiments with frequency of tremor. Maybe you could help. Do you ever have any that have real fast ones, or?
Not typically. So they're typically going to be a 4 to 5, maybe as high as a 6 hertz tremor.
What did you guys do?
Yeah, what did y'all get? Oh, did you do a Parkinson's patient?
Sure.
No, we didn't actually do it.
We were just trying to mimic it just to get an idea what the speed was.
On this,
You didn't do that? I thought you did.
well, I kind of did some with just me, but we'd probably be better if we had an actual patient that we tried it out with, so we have a better idea.
This is good though. You know,
We can use my grandpa.
From 2 to 10 maybe. Just get a
Just
range,
imagine
you know.
Grandpa have.
Yeah.
He has Parkinson's.
Okay.
Yeah, but that like as the saying, and that gives you an idea because you can figure that out pretty easily.
Yeah. So
And
I can
so-
go back and look at what frequency I was doing it with.
Many of the Parkinson's patients won't have tremor with writing though. They'll have bad tremor at rest, but when they go to put their hands into position or, you know, finger, nose, finger, or for handwriting, many of those patients are pretty good.
They override it. Just,
Yeah. It's just a different tremor type.
Right.
So when you see a posture action tremor, you're more likely dealing with an essential tremor than when you see a resting tremor, which is more likely to be a Parkinson's type tremor. Now that's not to say, because let me tell you, I saw a Parkinson's patient the other day, and he had terrible. I mean, his his handwriting looked like this, and it just looked like these big circles. You
Yeah.
couldn't, you know, today is a sunny day in Boise. It looked like this. So you really couldn't make much of it.
My father-in-law was like that too. His tremor didn't go away. It was there.
Would be there during,
So this would have helped him.
yeah.
Just depends on the patient. It's
Yeah.
really
And
patient.
so some of these patients have converted to keyboards because they have lost their ability to write. So they will keyboard, but the problem with keyboard is very similar. Then you get
Right.
5 Fs, or you know, there's a lot of
Mhm.
misstrikes. I have them dampen. You know, you can do that on a keyboard where
Yeah.
you really increase the strike, like you have to mean it.
Right.
But even then, it's tough.
Well, the other aspect of this is some of the kids are working on we're going to take a mouse, wireless mouse, and make a cradle for it that'll be dampened too. So,
That's a
Emery
great
was using
idea.
the big roller ball.
Yeah.
But still, that doesn't do anything for the tremor, so you still have to maneuver it. And I know they're looking at how much, there's some software stuff you can do too, right?
Yeah.
But
Yeah, there's a lot of.
it's not as much physical damping, so. Hi, Kenny.
There is.
Thank you. So, yeah, so that's the other part of it. So there's kind of two prongs that we're going on this year, so.
So what are your questions and needs? So you asked about essential tremor versus dystonia. So that's kind of in a nutshell. One more familial, more you know, tremor. The dystonias can be any body part, but typically are the arm or the neck in an adult.
Just didn't do your homework. I'm disappointed.
We were curious if maybe you had any ideas as to what we could use this for. So like we wanted to try the mouse and maybe like writing and drawing, but we were wondering if you have patients that maybe had a need for another activity that's something similar to this could help.
So the big activities are eating, which we were already trying to do. And this lady's going to have a similar problem, I think. I think it's handwriting and eating now. I'm just when I'm thinking about it. Yeah, I envision some kind of multi-jointed friction.
You can keep it simpler, you know, just, you know, you put the magnets in the sleeve, you know, kind of like what Sane was working on.
They
last
can go
year.
vertical.
Down
Pardon?
rather.
They can go vertical too.
Or you just, yeah, there's, I think, and Taylor mentioned something too about putting the magnet or inside copper tube or something and use that as kind of, you know, there's, I think we got some things we can play with there, so.
Right.
That was cool.
So having an ability to read a book or a newspaper is very important to them. So this might be a good tool for that, where they lay the book down or they lay the newspaper down on that, because sometimes they shake so much they can't do that. So that would be really good. Eating is usually a big one. Handwriting is a big one. And then, as I said, some of them have converted over to computers, but even then they notice that. So I think the mouse idea is a really, really good one.
And you're not aware of any other things people have done with mouse or Tremors? Software, I know there's some things you can put in the software.
Well, again, I think you have the ability to make your mouse not so sensitive, but I'm not aware of anybody else working on. So there is an iPhone app now for tremor, and I don't know if y'all have seen it. It's called iTrem, and it's going to be a way for patients to, it's got a the stupid phone has a gyroscope in it, right? So they can actually, it's almost like an actimeter. They can see how much tremor. So you change their meds, and then they hold their iPhone, you know, so many times a day or whatever, and they can upload data back to.
Tremors. Software, I know there's some things you can put in the software.
Well, again, I think you have the ability to make your mouse not so sensitive, but I'm not aware of anybody else working on. So there is an iPhone app now for tremor, and I don't know if y'all have seen it. It's called iTrem, and it's going to be a way for patients to, it's got a the stupid phone has a gyroscope in it, right? So they can actually, it's almost like an actimeter.